Tyler's always hitting a button to correct me.
We're 2 for 2, Ronnie. It's okay.
Thank you. I appreciate it. Hey, happy September.
Yeah, happy September. Happy new month. Did you stay up to midnight to celebrate the new month?
No, but I will
Neither did I.
say the moon has been amazing.
It has been. It's been very interesting.
You know what's really cool when you're texting people? Hey, get up, go outside, look at the moon. So, anyway, hey, good morning there, Tyler. How are you?
I'm good. How are you, Ronnie?
Happy September 1st. We are making it through 2020 one day at a time.
We're getting there. It's almost over. We got 3 more months. We got 3 more months after this, so we're getting there. It's almost over.
It does feel like we are living Groundhog Day, though, doesn't it?
It really does. In the worst way possible. It's every single day. It just feels like yesterday. It really does.
But there's always a silver lining, and that lining being that Mother Nature has delivered us awesome weather this summer. So, after the winter and after that crappy spring we had, and then coronavirus, at least we have to be grateful for something, right?
Yeah. Yeah, I mean, we really started. I don't know how much I have to say about that. I mean, we started off the winter in the worst way possible with a pandemic, and it was a real struggle for a few months there just to get through day by day. And now we're more used to it as much as you possibly can be, but still, it's a battle. It's a battle, Ronnie.
You know why you don't have much to say about that, Tyler? It's because you spend way too much time here.
Probably.
In the studio. Tyler is here like 24/7.
I live here.
You really do. You just put a cot around, but you need to get out. I keep telling him, get out, have fun. You should be out on the lake, getting a tan.
I haven't seen daylight in 6 months.
It's kind of like a vampire.
Pretty much.
Yeah, your tan there, Tyler, is lacking, but...
That's for sure.
Take a break.
It's been lacking for 25 years. What's another day?
Welcome to the Oakland County Megacast, everyone. This is Tuesday, September 1st, as we round into the fall season here on the Oakland County Megacast. Just to remind everyone, you can watch and listen to us on Civic Center TV Monday through Friday, 10 a.m. to noon. We work to bring you interviews with the newsmakers throughout Oakland County and the state of Michigan. And one of the great things that we get to do here on the Oakland County Megacast is give you extended interviews. So I was a reporter for years, and one of the hardest things that you have to be able to do is take a 15, 20, 30-minute interview and put it into a minute 15, minute 20. And you not to say that the interview and there aren't important information coming out of that interview, but however, it's just time constraint. And so one of the good things that we get to do here on the Oakland County Megacast is give you the full interviews. That way you get to make your decisions by yourself. We can ask the questions that you want us to ask, and they're extended, and you can get the full concept and the full feeling of that interview. And that's one of the great things that we do here on the Oakland County Megacast. So real quick too, we want to give a big shout out. So Orchard Mall today is going to be our Facebook partner of the day. And each and every day we try to team up with someone in the community to bring you the Oakland County Megacast on their Facebook page. So they're streaming us live. We want to say thank you, a huge shout out. They have a lot of great stores out over there. Premier Pet Supply, that's kind of our go-to place now for our pet food. Because the place we used to go, they have such limited hours, and it's all the way in Troy. So we found they have my dog's food. So
Nice.
Going right down here.
It's right up the street. It's really convenient. It's
It
a few
is.
minutes away from Kinko's, a couple minutes from the office.
Right. So they a lot of good stores over there in Orchard Mall. So a huge thank you to them for allowing us to be their Facebook partner of the day. And as a reminder, you can always catch us on the Birmingham Area Municipal Access. Listen to us on the radio, 89.3 Lakes FM, 88.1 FM, The Biff. So we have a lot to get to today, Tyler. So one of the big issues that we're still talking about, Tyler always forgets to mute his phone. One of the big issues, nearly 6 months into this pandemic, that we are still talking about COVID-19 testing. And more people are getting tested now, but how accurate are the tests? But the huge thing happens to be with the backlog at the labs.
Yeah, and that's still been a bit of an issue. We still get here and there some days where we have the testing results come back from the state, and it says, well, we have several hundred more cases that are being reported than have been over the last few days, but that's because we've gotten the last few days backlogged reports in as well. So it kind of gives a little bit of an inconsistency there, at least to the public eye, but those the powers that be that are researching this probably have a different understanding that keeps that a little safer than what it is in our minds when we see those big numbers come up here and there.
Yeah, it makes it hard for the state to try to track the cases and the outbreaks. So we're going to be speaking with Dr. Laura Lamb from Beaumont Health. She's a researcher over there. They've developed a rapid test. So we want to check in with them and see how that is doing, because I think rapid tests are really going to be one of the answers to help us maintain and control the outbreaks of this virus. Plus, one of our fall favorites. I have been looking forward to this day like forever. The Franklin Cider Mill is going to be opening. It's fall time. It's a family tradition, although this year is going to be a lot different than years past. I will say, I was reading their history. They first opened up that mill back there in the 1800s.
Yeah. Oh, yeah. It goes way back. And it'll be interesting to see how it's different this year, because that place, no matter what time of day or what day of the week you go there, it is almost always packed. So being able to open that up is an accomplishment in and of itself. Being able to do so with social distancing measures in place and with enforcing masks for inside the mill when you're picking up the cider and you're picking up the donuts and whatever. And outside when you're sitting there on the river and enjoying your cider and donuts with the family and with the ducks. It's going to be very interesting to see how they're going to be able to enforce that, to keep that facility safe and keep a tradition in the local area ongoing in 2020.
Yeah, so we'll be speaking with the owner here around the 11 o'clock hour, so be sure to tune into that. And then we're also going to be checking in with the student body president over at Oakland University. A lot of questions, a lot of uncertainty for the students, but what's good in this case is we're going to be talking to the student themselves, because a lot of times we do talk to the administrators, the superintendents, and they put these policies and plans in place, but putting them in place and having them on paper is different than actually implementing them and living with them. So we're going to check in with the student body president over there, and then end the show with a local actor, writer, and editor. How are they managing this pandemic as well? We rely on entertainment, but the entertainment industry has been sidelined by the pandemic as well.
Yeah, it's been a tough going for entertainment industry, especially film and television, and those productions, which all but came to a halt. Many of them had to piecemeal the rest of their shows together over the course of several months instead of shoots that would have taken a few days and maybe a couple of weeks. And so getting that perspective from somebody that's been both in front of the camera and behind the camera about the whole process and how that's changed over the course of the pandemic and will change because of the pandemic afterward, it's going to be an interesting take to get.
One thing that I think we've all found during this pandemic is that we are relying on entertainment to get us through. So movies, videos, it's so important. So when they're sidelined, how many reruns can you watch?
You can only do so many, Ryan.
Let's go ahead and get you up to date, though, with the afternoons or with this morning's headlines. So if you want to follow along with us, head over to civiccentertv.com. We post them under coronavirus each and every morning before we head into the studio. One of the big stories we've been talking about here on the show for a few weeks now, and people have been covering this, and this has been a big issue. Some of the businesses still ordered closed could get the green light to reopen. Fitness centers, theaters, bowling alleys, ice rinks, and related facilities ordered closed for more than 5 months during the pandemic are expected to get the okay this week from Governor Whitmer to reopen after the Labor Day holiday. The businesses and facilities would be subject to social distancing and sanitation safety protocols, as well as new requirements intended to try and facilitate contact tracing in the event of an infection. However, it is still unknown if the governor plans to address other venues such as convention centers, concert venues, and minor league baseball parks. Slowly but surely, hopefully these businesses get to reopen. One thing that we have seen, Tyler, is I was in Ohio. Gyms opened in Ohio back in May. And you have to remember, northern Michigan, those in zones in 6 and 8, these venues have been allowed to reopen, and there haven't been big outbreaks. So that's been one of the issues that some of these business leaders have been pushing and saying, if it is the data, if it is the science, share that with us. If not, please allow us to reopen before we close.
Yeah, and a lot of these businesses, too, have put forth plans, either as an industry or business to business, about exactly how they're going to go about doing that. So not only do you have the reassurance that the numbers are a little bit better now, that people are taking this seriously, and that people are clamoring to get back to some sense of normalcy and are willing to have the necessary trade-off of taking those extra measures like keeping 6-foot distance minimum, wearing a mask, sanitizing surfaces regularly, washing your hands more often, and all of that. They're willing to do that now more than ever so that they can get back to these normal things in everyday life. And these businesses have had 6 months to prepare because they've been on the sidelines. They're clamoring to get back open. They almost did a couple months ago and had in the case of gyms, and had the rug pulled out from under them at the 11th hour. So this is definitely an exciting time for them. We'll see if it happens this week. It's reported that it's going to, but we'll see. It's one of those situations where you have to believe it when you see it.
Yeah, after what happened the last time, right. I know some of the industries, such as the bowling alleys, came together and they actually filed the lawsuit as well. They pulled their lawsuit in order to be able to continue the conversations to talk about why they feel like they are safe to be able to open. And maybe these conversations have helped the governor come to her decision. So it is expected that she's going to either make that announcement today or tomorrow. And of course, when she does, we'll bring it to you here on Civic Center TV. Also, this is going to be an important one that's going to develop over the next few days. A task force is urging changes to COVID-19 in nursing homes and to the nursing home policies. The task force was appointed by the governor, and it's recommending changes to the state's policies for nursing homes during the COVID-19 pandemic. Included in the recommendations, limiting sending COVID-19 positive individuals to nursing homes that don't have a history of caring for the residents with the virus. And also it would allow for the creation of what they're calling care and recovery centers. About 32% of Michigan's COVID-19 deaths have been nursing home residents. This has been a big political issue for the governor. And so to have the task force come out and make these recommendations, they came up with the draft. It's going to the governor's office right now, and we'll see what actually gets implemented out of this.
And this is one of those things where better late than never, but it was a mistake early on. You knew it was a mistake early on. This probably should have been something that happened a long time ago. It definitely should have been something that happened a long time ago. A large portion of the COVID-19 cases and deaths in the state of Michigan have been in nursing homes, and policy had to be changed. It's one of the very large negative marks against the governor's response to COVID-19. So good to see that this is happening now, albeit a little bit late.
Also on CivicCenterTV.com, the USDA extends flexible free school meals for kids program. U.S. Department of Agriculture announced Monday it's reversing course and is going to extend the flexible free school meals program, helping to keep millions of kids fed amid the pandemic. Now, some of the options granted to meal providers over the summer, including flexibility to allow parents to collect free meals at any school, even without the children present, had been set to expire at the start of September. It's estimated some 800,000 children in Michigan get their only meals at school. This has been a big concern throughout the country and here in the state of Michigan, and it was actually Senator Stabenow, who is on the committee, on the Agriculture Committee, who pushed to have this extended because it's set to expire. And USDA basically said, we don't know if we have the money to be able to extend this. So there are rules and regulations that go along with these, free school lunch programs. And so obviously during the pandemic, they were able to get things changed and some measures put in place to allow them to give out the free food. And now with schools starting back, so many schools are still remote. So they want to make sure that these kids are still getting food.
Yeah, and this is something that was a big issue going into the summer when schools had ended because kids aren't in school, and for many kids in the summers, and during normal times, that's when they are at their hungriest because they're not getting those meals from school. And during a pandemic where parents are out of work even more than before, or are struggling even more than before, nutrition inequality is going to be even greater of an issue for those kids, and they got to be able to learn. They cannot learn when they're being malnourished. And on top of that, we need to be feeding the children. So great news from the USDA today.
Yeah, and it's only at this point in time they said they would do it through the end of this year, end of 2020, or until the money runs out. And then at that point in time, they're going to have to go to Congress and try to get additional funding. Or if we see this pandemic, the remote learning, or even the hybrid situation continue into 2021, then they're going to have to revisit this issue. But at least for right now, that is the good news, because, kids are starting school right now. And just an update that we want to bring you, because we did tell you about this back in the middle of August. Beaumont Hospital, the Farmington Hills location, is going to be loosening its restrictions on visitors that they implemented back on August 13th because of an increase in COVID-19 cases. Well, since that time, some good news. The hospital has seen a reduction in the number of new cases among family members, staff, and patients. So starting this week, starting Monday, yesterday actually, the Farmington Hills campus has changed the visitation policy back to the one in effect at other Beaumont Health sites as well. So just an update for anyone who has a loved one, or if you have to go to Beaumont, to that location. Still, there are measures in place. You have to know that you're going to have to wear a mask when you go in to visit people. You're going to have to use hand sanitizers, things of those nature. But all those stories and more on civiccentertv.com. Also, if you need the latest information, CDC resources, they're changing their policies each and every day. But also CDC, I check this site often just for the newest information and the newest numbers on COVID-19 and the coronavirus pandemic throughout not just the state of Michigan, but the entire country. You can go to Civic Center TV, find a link to the state of Michigan, as well as Oakland County and all of our local municipalities as well. One-stop shopping, Tyler, that's how we like it. Make it easy for everyone.
Yeah, make it really easy for them to be able to find all the information you need, whether it be at your local municipal level, the state level, the county level, or at the national level as well.
We've been so bombarded with information. It's hard to keep up with the information, and it's changing day by day, hour by hour sometimes as well. So it can be a little confusing for people, and I think they just get kind of fatigued on trying to find information as well. So in this regard, we try to put up all the reputable news sources and the links to our actual government agencies to make it easy for you to be able to get that information. One-stop shopping here on the Oakland County Megacast.
Yeah, that's what we do here. We want to make it really easy for people to go to one space to get all that information that they need, whether it be the latest news stories or the latest information, without having to dig through a bunch of different websites to find information that should be readily available to you.
So we're going to take a quick break here on the Oakland County Megacast, and when we come back, an interview that all of you are going to want to tune into, we're going to be speaking with Dr. Lamb over at Beaumont Health, and we are talking COVID-19 testing, an all-important subject at this point in time.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Parks COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
or blue.
But one thing we can all agree on,
to help stop the spread of COVID-19.
Wear a mask.
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 The ball's in your court, Michigan.
You know, it's estimated about 25,000 people are tested each and every day in the state of Michigan for COVID-19. But getting results of those tests, in some cases, we've been talking about it here, can take a week or longer. And that delay can make it hard to track and contain the outbreak. But researchers at Beaumont Hospital have been busy working on a solution, developing a rapid test. And to speak more about that, we want to bring in Dr. Laura Lamb over at Beaumont Health. Thank you for being with us on the Oakland County Megacast.
Thank you so much for having me here today.
I know we've had you on previously talking a little bit about this, and that was way back in the beginning. Can you tell us about the test and how it works and how you were able to develop it?
Yeah, so we've been working on a test. Unfortunately, it's not available quite yet to the public, but our test would allow you to use a nasal swab or a saliva sample, and we use a new technique called RT-LAMP, which basically allows us to make really quick photocopies of the virus so we can detect if the virus is there or not. And then it's kind of like a pregnancy test where we can run it out on a device where one line means you do not have the virus or detectable levels of the virus, and 2 lines would mean that you're positive for having the virus responsible for COVID-19. Again, this isn't available to the public quite yet, but we're working really, really hard to get it out there quickly.
So many people in the healthcare profession working around the clock to try to come up with vaccines and test everything related to COVID-19. So when do you anticipate that it would be available, and where are you in the process of getting it out to the public?
Yeah, that's a great question. So right now we're in the process of applying for federal funding. This funding would allow us to go through and apply for FDA approval for the test. That's a really important step. That process right now is allowable under what's called emergency use authorization. So it's kind of a fast pass compared to normal FDA approval, since this is a pandemic, and everybody at all levels of research in the government want to make sure that there's good, reliable testing available quickly. And the same thing is going on right now for different treatments. It's kind of hard to tell how long this process can take, because right now, again, we're in the process of applying for funding. It takes a couple months for that to go through the review process and possibly be awarded to us or other tests, and then you would start the process for FDA approval. So that's where we are currently, and we're I promise you we're working really hard on trying to get this done.
Testing has been so confusing for me because we hear so much about all of these various tests. You're hearing about rapid tests on the market now, and then there are other tests about antibodies. And how can you clarify some of that for us? Like, why is there the difference, and what should people really do, and which test should they have to get the most accurate results?
Yeah, so there's 2 types of main tests. One is going to detect the virus directly. It's only going to look for the virus. That's called molecular testing, or PCR. So that's the gold standard. That's going to be the most sensitive and the most accurate. And unfortunately, that's the test that takes the longest and has to be done in a professional hospital or clinical lab setting. So that's done with a nasal swab or a nasal pharyngeal swab, which is the very uncomfortable swab, I know, but it's going to give you the best results and the most accurate representation of whether or not you have the virus at that particular moment. It's not going to predict whether or not you have the virus in the future or the virus in the past. It's reflective of that moment when you took the test. The other big testing that's out there, and this is what a lot of those tests fall under for rapid testing, is the antigen or the antibody testing. This is serology testing. This is what it's also called. I know, and that's part of the confusion, is all of these things have different names. In general, serology testing is going to be less accurate than molecular or PCR testing. And so if you really want to know whether or not you have had or you currently have the virus, you're going to want to go with a molecular test. If you're asymptomatic and you are maybe just potentially exposed, serology testing is an option. The only thing you have to be aware of is that a negative result with serology testing doesn't necessarily mean a true negative. It's less sensitive. And so for some cases, if you get a negative test, your healthcare provider might recommend you still get a molecular test to confirm that you're truly negative for the virus.
We're speaking with Dr. Laura Lamb, Beaumont Health Researcher. How do you even start this process of coming up with a new test?
That's a wonderful question. So it depends on if you want to develop a molecular test or a serology test. With the molecular test, we need to know what's the bad guy, what's the pathogen. In this case, we know it's coronavirus, and we need to know the nucleic sequence. So what's the sequence of nucleotides or DNA, or in this case, RNA, that makes up that virus. Once we know that RNA sequence, we can go in and design things that will specifically pull out a section of that virus. So that's why it's a very, very specific test. And that's why it's very sensitive, because you're directly measuring the virus itself. With serology testing, we're actually looking at the body's immune response and to see if the body has seen the virus. So it's kind of an indirect test. And that's why it's a little bit less sensitive, because we're not looking for the virus itself. We're looking for whether or not the body has been exposed and potentially sees the virus. And in some of the antigen testing, we're actually looking for proteins that would be expressed on the outside of the protein. On the outside of the virus. So it's a little bit less sensitive. It's a little bit less accurate, and but it's a good option for cheap, inexpensive testing. You just got to be careful of those what we would call a false negative. So that's somebody that has the virus, but they got a negative result. And so for those type of tests, we either have to wait till we get people that develop immune responses so we can see what type of immune response we can measure in the people, or we have to grow lots and lots of virus and figure out what those proteins are on the outside of the virus in order to develop antigen testing for that.
Dr. Laura Lamb with us on the Oakland County Megacast. She is a researcher from Beaumont Health with us on the program today. Dr. Lamb, in developing those two different types of tests, which one is more tricky to develop? Because you said one's a little less accurate and allows for a little more rapid testing. The other one's a little bit more accurate and is often more effective. Which one presents more challenges in the development?
They both have their own unique challenges. The molecular tests were the first ones that were being used in the clinic, and the first ones to get FDA approval. The serology tests are what we've been seeing coming out more recently, especially the antigen testing. I will say that some of especially the antibody tests, again, this is measuring your immune response to the virus, whether or not you've been exposed to the virus in the past. Some of the tests that were originally FDA approved under this emergency use authorization have had that removed. They no longer have FDA approval because they ended up not being sensitive and specific enough. So again, molecular testing, if you really, really want to know if you truly have the virus at the time, is the gold standard for testing right now. Unfortunately, that gold standard for testing takes a lot of reagents and a lot of really trained personnel, and that's why you're having this delay in response. I know several people that have had to go get testing, and I know it's very, very frustrating waiting those couple of days to get a test result. And that's why we're trying to work on developing molecular tests that are fast and don't have a several-day wait period.
This testing, if it reaches the mass market, could really be a game changer, because you think of all the revenue lost for businesses, employees sitting out, things of that nature. If you get the funding and it comes to mass market, would it keep the cost down? Can you talk a little bit about that?
Yeah, so one of the things that we really like about the technique that we're using is, one, it's a molecular test, so it's going to have that sensitivity that we really, really want. But the reagents are a little bit less expensive than the test that's out there right now. And the time that it uses is a lot less. And lastly, it doesn't require an expensive machine to run. Right now, your PCR test, the molecular test that's being done, requires a machine that's about the size of a printer and the price of a new car. We don't require that for our new test. That's why we think that it can really help keep the price of tests down. And because of that, we really do need a fast, cheap test for reopening of businesses and schools and local economies, because it's not that people need to be tested once. They're probably going to have multiple exposures as we reopen. And so they're going to need to have the availability to have repeat testing.
Yeah, I think people forget when you get tested, it's just that snapshot and that moment of time. You could go somewhere after you take the test and pick up the virus there. During this pandemic, one thing we've seen from the healthcare industry is how healthcare workers across the globe have been coming together, sharing their research and their information to try to tackle COVID-19 as a team. Can you talk to that? Has your team been involved in reaching out to the healthcare industry and researchers across the world, and have you shared your research?
Yes, it's really been amazing how rapidly the global scientific and medical community came together to share resources. So I talked in the beginning, for developing a molecular test, we need to know the sequence that makes up that virus or bacteria. That information was out there and available early January of this year, which was absolutely amazing that people were rapidly putting that information out there, because it's not only useful to researchers like me that are developing diagnostic tests, but it's also really helpful for the people that are trying to understand, how does this virus work? Why does it make certain people more sick than other people? How does it get in the body? Because if we understand those things, that's how we can develop therapies for this that are specific for this disease, and maybe even prevention strategies, or understand why, maybe it targets older people more so than younger people, or certain demographic groups other than other groups. So all that information became available. We actually made the recipe for doing this test publicly available and freely available to the world in late February of this year. And so we've actually been in communication with researchers from Europe, Africa, Asia, South America, Central America, the United States, Canada, all over the place. And there's researchers out there that are using this type of test, or tests very similar to it, for research purposes, to understand which populations are getting sick, and maybe using it in situations where they don't have maybe the same medical resources that we're fortunate enough to have here in the United States. So it's been amazing. We've definitely shared this through virtual meetings and gotten feedback from other research groups. And one of the other fantastic things about this global network of sharing is other groups from around the world that have tried this test have come back to us without us even knowing that they were using this type of method, and told us that it works in their hands and their setup under their conditions. So whenever you have this external validation, it's a very rewarding thing. It really strengthens that this is something that could work.
Dr. Laura Lamb with us. She's a researcher at Beaumont Health, with us on the Oakland County Megacast across the local area. Dr. Lamb, earlier you talked about the training, that it takes more training and more expertise for the current gold standard testing in order for that to be developed and for that to be processed. For your new test, what kind of training would go into that on the medical side to be able to process those? Would it require similar training to the current test under the gold standard, or would that require less training and make that even more so efficient?
That's a wonderful question, and to be quite honest, I'm not quite sure if we get a final product made and FDA approved, 100% what that answer would be. The nice thing is, it does not necessarily require a high technology hospital laboratory to run. It could be done in much more simpler conditions, and it definitely does not require a PhD in biochemistry to be able to run this test. I could train somebody that is able to follow simple directions to be able to run it. The FDA, however, has very stringent regulations on what can be done by who under what settings. And so we're going to have to follow their guidelines. And that's kind of the best I can say. We will do everything we can to make it most available to most people, because this is something that is very simple and most people could probably figure out how to run, especially if they were trained. But we're going to follow FDA guidance because that's the rule of the law, and there's reasons those rules are in place.
Are you concerned because the FDA's rules are maybe stricter than in other countries that another company or someone else could develop this before you get a chance to get it to market?
I think that the current pandemic, we need multiple testing solutions out there. And so if another company comes to market before us, then that's the case. I'm not going to feel like I necessarily have to be the driver in this case. I would love to be along for the ride because I've worked so hard on this and our team's worked so hard on this, but we need testing solutions now.
And those testing solutions, like when you say we need them now, we so need them now. We needed them in March. We needed them in April. What's next? Where do things stand right now for you and your team?
So as I mentioned, we're applying for federal funding. Keep your fingers crossed that we're fortunate enough to receive it, because that will allow this, to really take off and move forward. We're also working with other research teams nationally and globally, not only on diagnostic testing, but also really understanding, what populations are more susceptible to getting this virus and getting truly, really sick from it. So not just, you stay at home, you quarantine for a couple days, but the people that are going to unfortunately require hospitalization and maybe even ventilators and so forth. So we have other projects that we're working really hard on. There's some other fantastic teams here at Beaumont, and I know also regionally at U of M and Henry Ford and DMC, and no one hate me if I didn't include your group, but there is some fantastic work that's going on. And again, want to re-emphasize to your viewers that this is something that we're working really, really hard on, and we appreciate your support.
I know you have applied for federal funding. Is there a possibility of a private company or of a private entity providing funding for something like this as well?
If someone is willing to do philanthropy through an individual or organization, please reach out to the Beaumont Health Foundation, and they will definitely help facilitate that to help support this research, and we would definitely appreciate it.
Dr. Laura Lamb with us on the Oakland County Megacast. She is a researcher at Beaumont Health, and they are currently working on a rapid COVID-19 test. They're awaiting hopefully some federal funding to be able to get that test through the FDA process of FDA approval and hopefully get that test out to the public relatively soon. Dr. Laura Lamb, anything else that you'd like to speak about in terms of this test and the process, the stage in the process of getting the FDA approval down the line that this test is in?
I just want to say thank you once again, and we're very excited about being able to help contribute to this pandemic in one way or the other. So thank you again.
So Dr. Lamb, I have a personal question kind of for you. What's it been like for you to work on something like this that could be such a game changer for the entire country and the entire world?
Our normal routine for our group is we actually study benign bladder disorders, so diseases that either cause a lot of pelvic pain or maybe result in individuals becoming incontinent. And so we actually work for developing diagnostics. So it's been really rewarding that we could pivot so quickly from what we do normally to very early in this pandemic, being able to develop something that could be helpful to the global community. It's definitely something that we're all putting, lots of hours into, and it's been, to be honest, maybe a little frustrating at times because I feel like we have a solution and maybe we're not able to get the right people to see it or get the right resources in line. But that's part of the process. Science doesn't happen overnight, and yet right now with the circumstances, we're trying, everybody's trying to do things as quickly as possible without sacrificing quality. Because if you get something that doesn't work to market, you not only waste a lot of people's times and resources, but you also lose that faith of the public in science and in medicine. And that's something that is very valuable. We don't want to ruin that trust. So that's why, you know, as burdensome as some of these regulations are, it's really important that we follow the guidelines so that we don't somehow betray that trust.
I know that typically, is it something like this would be years in the making? So when did you start it? And then to have it this far along at such a short amount of time is somewhat of a miracle in itself, right?
You're absolutely right. So we actually kind of got involved in doing another infectious disease caused by a virus a couple of years ago. So I'm sure you've heard of Zika virus. We used this same method for Zika virus a couple of years ago. And the whole process from us taking, you know, knowing the sequence, developing the test, and sharing it with the larger scientific and medical community took like a year and a half, 2 years. And for us, when Corona came out, because we had that previous experience and we were so eager to really help, we were able to kind of condense that process down to 6 to 12 weeks. It was really amazing. So we really benefited from previous experience. And again, because this was such a short, get it out the door type of thing, seeing that other groups throughout the whole world have been able to validate what we've observed has been really great, because it really says that even though we did this in a shorter time frame, other groups can still do it. Other groups see the same thing. So it really validates our initial findings.
Dr. Laura Lamb, one of our true heroes right here in our own backyard. A huge thank you and shout out to you and your team and all the time and effort that you're putting into this project to help all of us. It really is an honor to have you right here in Oakland County. So thank you for all your hard work.
You're much too kind. Thank you so much for having me. And hopefully we can all get some cider at the Franklin Mill soon.
I know they open September 5th, so mark your calendar.
I know, I'm so excited.
It really is the little things back in the middle of this pandemic, right?
Yep, everybody wear your mask and wash your hands and we should be good.
Thank you so much. Dr. Laura Lamb, researcher over at Beaumont Health, joining us on the Oakland County Megacast, doing amazing things as they continue to navigate coronavirus and this pandemic. Testing, Tyler, is going to be key to getting us through this entire process and getting us back to some sort of a normal.
Yeah, it is, and it's been such a crucial part of this entire process for our society and for the world since really January, when this virus was beginning to be on the radar of a lot of these different different medical communities throughout the world. And immediately development of a test went into motion, and they were able to develop these tests really quickly, surprisingly quickly. And you spoke about that with Dr. Lamb, and now we're at a point where, 3-4 months ago, those tests were taking a week to get results. Now we're in a matter of days, and soon with tests like they're doing over at Beaumont Health, if that gets FDA approval, it could be a matter of hours and be extremely accurate within the gold standard of testing. So it's really been amazing to see what our medical community has been able to do in a very short amount of time in order for us to be able to get more information and make better decisions with that information about COVID-19 as this pandemic continues.
Accurate testing is going to be key, because we have seen too many times, too many cases where the test results are not accurate. And I think that took center stage with the pro football teams, Matthew Stafford, them bringing it to light, because this is impacting businesses' lives. You're putting things on hold. Maybe you can't go to school. You're having to quarantine. You can't leave the house. So this is to be able to get an accurate test in a timely manner can definitely be the game changer in trying to get life back to some type of normal, but also allowing our officials to be able to track and manage the virus as well as these outbreaks. Because if you're getting the result a week later, that doesn't do a lot of good, because how many more people were exposed in that time? It makes it hard to manage.
And the rapid testing is even more crucial. Getting tests that are more rapid, like the one they're working on developing at Beaumont Health, now more than ever is crucial, because we're having so much more exposure. We're getting back out into the society. It's not like March and April and even parts of May, where we were very isolated still, and we were keeping away from each other to keep away from this virus. We're going back to work. Our kids are back in school. We're getting back to extracurricular activities. We're reportedly going to have gyms and theaters and bowling alleys be back as soon as next week after Labor Day. So there's more points of exposure that are out there, and that means there's going to be a need for more testing, because like you said with Dr. Lamb in that interview and we just had, it's a snapshot in time. You can get tested today, get results in 48 hours later on this week, and then over the weekend get exposed again and not know it, be asymptomatic, not get another test for a couple of months, and then find out then that all this time you've been asymptomatic and have had COVID-19. So being able to have rapid testing that can be done regularly as we're having all these more exposures is only going to keep our society that much safer from COVID-19 and make us able to make even better decisions down the line as we try to bring some semblance of normalcy back into life 6 months into this pandemic.
And we try to look at the silver lining as we continue to navigate this pandemic, and one of those silver linings being how people in the medical community have come together globally to bring their resources, bring their knowledge, and put it out on a platform so that everyone can use it and everyone can share it to try to combat this coronavirus once and for all, and do it as a global team. And we've talked to enough doctors here on the Oakland County Megacast over the past few weeks and the past few months. This has really never happened before. So maybe the silver lining coming out of this is not only this sense of community, of working together to try to come up with solutions to so many of these health issues, not just the coronavirus. We can hope that this continues post this pandemic as well. We'll see. So we're going to take a quick break here on the Oakland County Megacast, and when we come back the next hour, we're going to be talking cider mills, and we are going to be talking movies here on the Oakland County Megacast.
Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services. Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Thank you for joining us on the Oakland County Megacast. You can watch and listen to us on Civic Center TV, Birmingham Area Municipal Access, on the radio 89.3 Lakes FM and 88.1 FM The Biff. We want to say a big shout out today to Oakland Orchard Mall, right here on Orchard Lake in Maple. If you haven't been over there, swing by. They have so many good stores. They're back open for business, and I will tell you one business that will be excited over in Orchard Mall to be able to reopen if they can will be Planet Fitness. It has been closed since mid-March now?
Yeah, it was just a couple days after our first cases in the state of Michigan, a few days after our first cases in the state of Michigan, that gyms closed down. Some have reopened and have gone against the law and against the grain, have incurred those fines and the threat of losing their license to continue their operations. But many, like Planet Fitness and other gyms in West Bloomfield and in the local area, have been following the letter of the law since that was enacted and are very excited to get back to regular operations, possibly next week.
Yeah, so fitness centers, theaters, bowling alleys, ice rinks, just some of the facilities that were ordered closed more than 5 months ago. Well, they are expected to get the okay this week from the governor to reopen after the Labor Day holiday. The businesses and facilities would be subject to social distancing and sanitation safety protocols, but also a new requirement would be implemented that would be intended to facilitate contact tracing in the event of an infection. It's still unknown if the governor plans to address other venues such as convention centers, concert venues, and minor league baseball parks, but this is got to be good news for so many of these businesses. The bowling alleys were saying if they don't reopen by today, September 1st, a lot of them may be shutting down because this is when their leagues start.
Yeah, and this is right. It's just that high time to be able to get those businesses back in business. Some of them, they had said, had a couple of weeks left when we spoke to them, and it's well beyond that. But maybe they're pushing out a little bit further before they make a decision to pull the plug. And now with this information, knowing that maybe it's another week out there, maybe it's one of those situations where, okay, instead of saying we're done, we can't survive any longer, you do whatever you can, you stay open a little bit longer, and maybe the next week over when things reopen, you have some hope down the line. So good news for a lot of different industries who have been waiting, who have had plans in place to reopen safely, who have been patiently and in some cases impatiently waiting for the governor to make a decision that they can reopen like many other industries have.
One of the other headlines coming out of Click on Detroit just now saying that another reversal could be coming for some fall sports, including football. We had Mark Hall on yesterday with the Let Them Play group. After moving football to spring, the Michigan High School Athletic Association is doing an about-face. There are 33 other states offering high school sports right now, and when the MHSAA decided not to allow it, outside groups moved in, try to offer schools that wanted to play an option. So now the MHSAA is saying this decision is going to be up to the governor on whether or not to let high schoolers play sports, not just football, but some of the other sports as well.
And I think this is a little bit of a cop-out for the MHSA, if I'm being entirely honest, because they had discussions with the governor. They had made a decision based on those discussions, based on the numbers, based on who they spoke to about COVID-19 data and the spread of COVID-19 and the safety and efficacy of playing sports that are such high contact, like football, like soccer, and so on. And they got a lot of pressure coming back at them, and I think now that they're trying to find someone else to place some of the blame on so that they don't have to make a decision that they don't entirely agree with, but at the same time they can say, well, it's not our decision to keep football until spring. It is the governor's decision, so we're not the bad guy here. I don't entirely agree with the process that they're taking to make this decision. If they wanted to have football be played, they could have delayed the season and made this decision later on.
We are seeing it played in other nearby states. I believe Ohio and Indiana both are allowing it, and basically they're saying it's going to be up to the individual school districts whether or not they are going to play it, because there have been some school districts in the Cleveland area that have opted out because some of the students did test positive for COVID-19.
Yeah, and we've even had that locally in many different teams in Oakland County and throughout the state where they had some outbreaks, and it brings up questions about what happens when you do have an outbreak on a team. And then you got to think about the team that was previously played the week before. You got to think about the team you're playing this week. How many other players have been exposed? You got to wait for the testing results to come back. And there's a domino effect there that could affect several weeks worth of games. And so you're making the decision of how long do we wait for the next game for these teams? How do we adjust with other teams? There's a lot of complicated information that goes in to those plans. I'm sure those plans are in place and those discussions have been had, but it still is a big question in terms of these high contact sports like football.
There are so many decisions and so many different avenues to these topics. It's not an easy answer. I will say one of the good things that we're hearing about today is the USDA is extending the flexible free school meals for kids program. U.S. Department of Agriculture announced Monday that it was reversing course and would extend the flexible free school meals program, helping to keep millions of kids fed amid the pandemic. Some of the options granted to meal providers over the summer, including flexibility to allow parents to collect free meals at any school, even without the children present, have been set to expire today, the start of September. Well, now that's being extended. It's estimated some 800,000 children in the state of Michigan get their only meals at school. So at least this is something good for the parents that are worrying about being able to feed their children on top of so many other things going on. I mean, these parents are having such a hard time. My Facebook has been flooded this week with parents having to navigate remote learning, their jobs, trying to find childcare because some of these school districts only made that decision last week or 2 weeks ago, and they're all scrambling. And this is such a hard time. So at least being able for the schools to provide these students some food is a bit of relief, which is good.
Yeah, and it's something that's going to be very necessary for these kids. So you got to be able to feed the kids in order to keep their minds sharp and to keep them energized and to keep them developing at a normal rate. I mean, there's no reason that in the United States of America we should be having children going hungry while they're in school, while they're out of school, whatever the case may be. So this is great news coming from the USDA this week.
So you'll find those stories and more on civiccentertv.com. We update the headlines each and every morning. Tried to make things easy for you as we continue to get through each and every day, which I know, it feels like Groundhog Day. How many days were actually in the month of August? 450?
Yeah, it was a great 1,000 days in the 31 days of August.
Hey, and while you're over there on civiccentertv.com, be sure to check out the resources. We put the links to the CDC as well as the state of Michigan. Also, if you by chance missed any part of the Megacast, you can just click on Megacast. And we also put clips to a lot of our interviews. So if you were unable to listen to the entire interview, one of the great things we do here is we are able to go ahead and allow people 15-20 minutes to be able to talk at length about any topic so that you can get the full feeling and the full scope of each and every issue. And so you can find those interviews on civiccentertv.com. cidermill.com as well. Well, we want to go ahead and Tyler, we're going to take a quick break or just dive right into our next guest.
We can take a really short break just to make a couple of quick adjustments and then come right back after about 1 minute with our next guest, Laura Peltz from the Franklin Cider Mill. So we'll do that. We'll come back in just a moment. You are watching and listening to the Oakland County Megacast.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. You're listening to us on 89.3 WBLD, Orchard Lake, 88.1 WBFH, Bloomfield Hills. I'm Ronnie Dahl alongside the one, the only Tyler Keith, as we work each and every day, 10 a.m. to noon, bringing you the latest interviews with business owners, newsmakers, and everyone else here throughout Oakland County and the state of Michigan impacted by COVID-19 and the pandemic. I will say our next guest, I really wish we could be on site for this, Tyler.
Oh, so do I. So do I. It's such a great environment, especially now we're in September. The fall season is upon us, and it's time to go back to our favorite cider mills.
Laura Peltz joining us on the Oakland County Megacast. She's the owner of the Franklin Cider Mill. Laura, thank you for being with us here on the Megacast.
And thank you for inviting me to be able to share about Franklin Cider Mill and this incredible season that we're going to be entering. So thank you. You are by far one of the favorite fall destinations for so many of us here in Oakland County. Some cider mills have decided not to open this year. I'm happy to see that you are going to be open. Tell us a little bit about how things are going to be different this year. So this year at our mill, we've got some major shifts because of COVID-19, which is no surprise. Every business that is open is having to make these major shifts. So this year, we began planning these shifts way back in April because we had a good feeling that COVID was really not going to be going away and that we needed to prepare what we were going to be doing with this National Historic Site differently. And so I'm pretty excited to share what we've done and how we're going to be responding. So if you want to know some of the basic things, our primary piece is that, apples get ripe and they need to be pressed for cider. So we had to open, we had to figure this out. Our focus, though, has really been on how do we keep our customers safe and our staff safe and our products safe. So those have been the premises that we've been working off of. And we know that as far as our staff, we've had them all COVID tested. They weren't allowed to begin with us this coming week until they tested negative. So we're excited to say that we've got all of our staff who are testing negative, and that was key and essential. We'll be using the proper PPE, so staff will have gloves, they'll have masks, sometimes they'll have a shield, and so we're going to be doing all of the sanitizing and disinfecting of our surfaces that my staff are touching and that customers are touching throughout the mill and throughout our area where customers often just stay and hang out across our river, around our river. So some of the things that we've decided to continue is we've decided to continue our delicious cider, our warm spice donuts, and also gluten-free donuts and some vegan apple bars. Our apple pies will be available again, both the regular and the Dutch, and our fabulous new addition to our pies, which is our apple cheesecake pie. And it is my all-time favorite. And I think anyone who's tasted it, it's their favorite too. We'll continue to have caramel apples and slushes, our Hickory Farm cheeses and meats, along with our incredible Michigan-made products, maple syrup, honey, jams, chows, and many more of your favorite items. So those we wanted to make sure and be ensured that we had those available for you. So some of the things about what's different is that we now have a brand new website that we purposely created under COVID. One, because we're now adding to our National Historic Site, Cider Mill, we're adding online ordering. And so for many who visited the mill and know that the crowds can start getting you a little bit frustrated, but we can't move them quite as fast as everyone would like, online ordering is a totally separate option. And we have designated our front parking lot and our front of our mill to just online ordering. So if you're coming just as a good old customer, don't come in our front area where you usually head on down to our lower level parking area, because that's where all of our sales will be this year. We've on our website, looking for online orders, there are a few things that you'll have that you won't be able to see at the mill. So there's no coming into the front of the mill and watching the cider pressing process. But if you go online, we have an entire page devoted to videos and pictures and a description of our cider making process. And you could also download our famous apple poster, which gives you which apples are ripe during which part of the season and what are they best for. So please, that's a free download. We're going to be offering all of our sales out of our lower sales area. So people coming in our lower parking lot, it is a natural, handicap accessible and also buggy accessible for baby buggies and strollers. So it is a fully accessible route into our lower sales area. And we'll be making sure that everyone who is coming into our lower sales area that we refer to as the community spot, that they will have a mask on. If they don't have a mask, we will offer them a mask. And if they are challenged by wearing masks, then we will take their order before they enter the community spot to keep our community spot safe. We'll be doing social distancing there. We've got enough staff to be able to keep the lines short. We're going to be asking for only 1 or 2 family members to come in line rather than a whole family, because keeping safe distance is so challenging then. So we've got benches along our river for you to be watching our ducks, drinking some cider, and duck food will of course be available again because it's so much fun for children and adults to feed the ducks. So we're looking for having you come to our cider and taste some of our incredible first of the year cider, which gets changed over the year as different apples come in. We don't have apple orchards and never have. And so we can buy apples from all over Michigan when they are ripest in our season here, and be able to make a fabulous mixture, our special recipes for our cider. Coming in the end of September will be our Honeycrisp, solely Honeycrisp apple cider, which is just fabulous. So we're not going to be having a lot of space. There won't be any vendors this year. Hickory Farms will be open. Our Apple Shack will be open, and we'll have both pecks and bushels of apples available for you. We're excited that So many people have been calling in again, asking could they do different events, birthdays, weddings at our mill, and we're not able to do those this year, but you can certainly tailgate in our parking lot, and we invite you to take a walk down through Franklin Village and the unique businesses there, and there is a wonderful village green for you to have a picnic on. They have picnic tables, you can bring your own blankets, and it's just a lovely, lovely spot to enjoy your cider with your family.
I've been coming to the mill for years and even covered it, like, as a reporter. I would be out there for hours, and I never realized that there are different apples for different times of the season. So which one is your favorite? What is the best time?
Well, cider for me is just delicious across the board. If you're a frequent visitor, you begin to note the changes. And as the season goes on, once there's a frost and we have apples, it's even richer and deeper flavor. So come November, when things seem to slow down, it's really the best time to come and get cider. So if you haven't had our November cider, it is a wonderful, wonderful cider. And it's funny that you said that you've been coming here for years. When my niece and I took over the mill as the next family members, because this was purchased by my father in the middle 60s, and he intended it to be a family tradition. And so my father ran the mill. My brother ran the mill until he became ill. And then the next in the generation was myself and my niece, Melanie. And so we're both in partnership running this mill last year and this year. And we look forward to do that because we found out, at least I found out last year in talking to so many of our customers, that this just wasn't a family tradition for my family. It was also a family tradition for almost every family that I met. So we love it that it's your tradition along with our tradition.
Laura Peltz with us. She is the owner of the Franklin Cider Mill with us on the Oakland County Megacast. And while many other cider mills and many other businesses that can be open in this season have decided not to open, you have. And with what you mentioned about this being a family business and this being a family tradition for a lot of different families all throughout the local area, how did that play in to the decision to put in all this legwork to make your cider mill open in this season, albeit with social distancing and other COVID-19 measures in place?
How about this mill has been established as a mill since 1914. And so we have never had a season that we weren't open. After my father purchased the mill, his intention was to keep the mill exactly the same as it had been. And there had been a mill pond that ran our water wheel that generated the energy for our pressing and our grinding of the apples. And suddenly there was a huge flood. The mill pond exploded, and no longer did we have water flowing through our water wheel. So my father, even in his first couple of years, had to make some changes and put electricity into the mill so that we could run our grinding and our pressing. So we have made some minimal changes that way, but every generation has added different things to the mill. And we've still maintained the same quality cider, the same pressing that we've always done. And let me mention the same recipe for our warm spice donuts that has been here since the early 1900s. It's an old German spice recipe, and it's paired perfectly with our cider. Just like, you buy your wine to pair with the food that you're going to eat, our cider and donuts go together as a perfect pairing. It's often the thing that I read most of all about our donuts, and they're fabulous.
So you had mentioned that this year you're going to have a new apple cheesecake pie? How do you come up with the recipes?
We didn't come up with the recipes, but we have a special company that just makes our pies for us. And they introduced that several years ago, and it's become a favorite. We pretty much sell out of pies every day of every weekend, and so we keep our pie maker pretty busy. And but that cheesecake apple pie is just absolutely delicious, and it comes in a large pie and a small pie. So if you don't want to jump into it too quickly, you can get the smaller version.
It's definitely going to be on my list this year. And while we, the public, get to enjoy the cider mill, 3 months, Labor Day to Thanksgiving, those months in the fall time, I would imagine that you don't just work 3 months out of the year. What's it like to run the mill the rest of the year? Give us an insight as to what you guys are doing outside of the cider mill open to the public time.
So as I mentioned, we pretty much began in April, and we usually begin just about that time. My family and I have conversations throughout the year, but we have to sense the environment, as we did this year, to begin to figure out how we can do what we do. And so we've made the changes that we needed to make, and we're ready to go with them and excited about them. So we usually start in the middle of July, actually in the mill, taking an assessment of everything, what's happened since we left in December of the year before. And so we've done that. We've got a work crew that's been working, rebuilding pieces. This old mill has every original structure in it. So keeping up with that is a regular task. So every year we've got to be looking at what do we need to repair, what do we need to replace, so that our mill sustains its authenticity. And I think that's part of why people come here, because it is old, it's on a beautiful site, and they get great service, and of course our product is fabulous.
I will say one thing, I think I'd be happy if you could do away with the bees. I know they're important, but trying to dodge the bees every year.
So, ever since I started working at the mill with my father, we've had a bee problem. If you could believe that it is a third or a quarter of what it used to be, that would be wonderful. So we're moving the actual convenience spot for our customers to not be in that lower sales community spot, but instead to be across the river. And I think that will draw people away from the spots where the bees are most enticed to come. And where they come is when we dump the pulp of our apples behind the mill. And so from every apple pressing, there's apple pulp that isn't good for anything, unfortunately, because all of us wanted to recycle it, but there's no good reason to use it. It's high in acid, but it does attract those bees. So if you take your products and go across the river to the convenience spot for people to just kind of hang out with families, I think the bees will be minimized for you.
So I know that one of the things that you had mentioned, and it's always been an issue, is you are in a very tight spot there in Franklin. So this year, are you going to limit the number of people who are actually parking on your property, or are you encouraging people to park up in the city of Franklin, visit some of those shops, and maybe walk down? How are you going to manage that?
Well, we have a unique situation this year, and that is the road going through the village of Franklin is under repair. And so all the traffic coming north on Franklin Road won't be able to get through Franklin. So best bet is to go down Telegraph, up 14 Mile Road, come down Franklin from Maple, if you want to join us, and it'll be easy still to get into our lower parking lot for those who are customers, and for our online parking and our Grub. Oh, we're also offering Grubhub. I may have forgotten to mention that. Then that is for our front parking lot only. In and out, quick pickup and move on. So the village is a wonderful place to walk through, even with the construction. The village stores are unique. The village is as old as the mill is. So actually a little older, but it's a very, it's just a special and very calm place to be. So it's great for relaxing and taking a little bit of time out of being cloistered in your homes for COVID.
Laura Peltz with us. She is the owner of the Franklin Cider Mill with us on the Oakland County Megacast. Laura, just another couple minutes with you before we'll let you go. Is there anything else you'd like our audience to know about the Franklin Cider Mill and its operations in 2020, or any other information that we didn't speak about today?
I think I've covered most of it, but what I just want everyone to remember is our number one concern is keeping our customers safe, and we've done that with all of the minimal and major changes that we've made this year, keeping my staff safe, who I said have all been COVID tested and they've all shown negative, so they're ready to start the season with us, and our products safe. So those are the key pieces that we're doing. We're ready for you. We're excited to open up on Saturday. We know that there's going to be a traditional group that come the opening day every single year. I met them last year, and we're looking forward to having them join and have all of you join us over this Labor Day weekend, which looks like we're going to have some great weather and not too hot to drink apple cider, cold apple cider and slushes. What a great idea for this weekend.
My mouth is already watering. Thank you so much for being with us. Taking time out of your schedule as you guys prepare to open. I love the cider mill, Tyler. It's awesome. And to know the history behind it and that it is a family business is just great. So thank you so much, Laura. And you know what? Good luck to you and your team this year as well.
Thank you. We're running on what's called innovation. And as far as innovation goes, that means that we have no idea exactly how all of our plans will work out, but we're ready to tweak them to make it as comfortable and joyous visit as possible for everyone. So thank you for inviting me, and I'm excited to see you. Ask for me when you come to the mill, please.
I definitely will. Thank you so much. Laura Peltz with us on the Oakland County Megacast, Franklin Cider Mill. I'm definitely going to be getting some of that cheesecake, and I will say for my multiple visits, because you never do the cider mill just once.
Oh, no.
Grubhub might be the way to go, Tyler.
That is a game-changing move right there. People are going to be Grubhubbing the Franklin Cider Mill for days on end over the course of the next few months. That's going to be a big one for people over the next several months here in the local area. It's definitely a favorite. You never go there once. I love the cider. I love the apples, almost even more than the cider.
Yeah, a little disappointing that you can't go in and watch them press the apples, because that is such an interesting aspect of going to the cider mill that you don't see every day, and it's an education for young kids as well.
It is.
But things have to change during this time. We understand that, but we all are really going for the donuts and the cider, so that's good that it is going to be returning here. So the Franklin Cider Mill opening Saturday, this Saturday the 5th, and then they are open through Thanksgiving as well. We're going to take a quick break here on the Oakland County Megacast, and when we come back, what's it like to be a college student right now? We are going to be speaking with the student body president at Oakland University. You're watching and listening to the Oakland County Megacast.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home. So
it's back to school time. Time for your cider, your donuts, but also time to head back to school. What a crazy, crazy year. I think when so many of the colleges had to close down in March, it was survival time, and that's how people kind of approached it. But now we've gone through the summer, we're heading back into fall, and to still be in the middle of this is a challenging time for a lot of college kids. And so to speak more directly on that issue, let's bring in Ethan Bradley. He's the student body president, Oakland University. Thanks for being with us on the Oakland County Megacast.
Thank you for inviting me. It's great to be here.
So classes start this week. Are you going to be virtual, or do you have any actual in-person classes?
All of my classes this semester are online. I had one that I had planned on that was going to be in person. I changed it for unrelated reasons, and the new class is online. But I believe about 15% of all of our classes are going to be fully in person, about 35% hybrid, and 50% fully online.
So as a college student, do you feel like you're getting all out of your education and the tuition that you're paying in a virtual class setting?
It's certainly a change from what it was before, but I still feel like my tuition is going towards valuable things. So because Oakland is a fee-free university, our tuition pays for all of the services we get. And a lot of those services, a lot of the typical services we have, like the recreation center and our free printing on campus, is less useful this semester than it typically is. But there are other things that the university is doing that they're having to spend that money on. And I think that that's a fair trade-off. Now they're not providing as many of the in-person services, but they are providing a lot of safety services like free testing for all the housing students, and bio buttons, which help track your vitals to predict when you're going to get sick.
So Ethan, what are you studying there at Oakland University, and when do you graduate?
I'm studying political science and philosophy, and I'm graduating at the end of next year, May 2022.
So you're kind of a liaison with the students there on campus. What are you hearing from other students?
I'm hearing largely disappointment with the enforcement system. So Oakland has a lot of plans, a lot of guidelines that will keep people safe if they're followed. And people generally do seem to be following them. But when people don't follow them, it seems like the response might come too late. So they're currently working on adding COVID guidelines to the Student Code of Conduct so that you can get in actual trouble for not following them. But it still seems like by the time you've gotten around to punishing a student who isn't following the rules, they've already endangered other students, and there isn't a lot of that immediate enforcement that's going to stop people from getting sick unless they choose to follow the rules of their own accord.
Ethan Bradley with us. He's the student body president at Oakland University with us on the Oakland County Megacast. So you are now the student body president at Oakland University. It coming into this at a very unique time in history. What is it like so far for you? What has it been like so far for you representing the students of Oakland University as they're navigating through this, and they are communicating as well with the university as both sides are trying to put their best foot forward in a semester and possibly a school year that will be like none other?
It's been very interesting. Right when this started, I thought that it was going to be sort of brief, and I made jokes about how dealing with this was going to be something I put on my resume. But then it went on for 5 months, and now it's a legitimate skill I have to respond to the kinds of concerns associated with this. We've been increasing the frequency with which Student Congress is hearing concerns from students. So typically we have a student concerns forum every semester. This semester over the summer we did one every month. And that I think was really valuable in making sure that the students are able to understand the guidelines and the new policies. Because I think that communication is going to be the most important thing here. We need to make sure that students understand these policies so that they can follow them appropriately, so that they can be safe. And our Student Concerns Forum have been our primary way of making sure that students can talk directly to administrators and staff to get a grasp of what these policies are and how they're going to affect students.
Hey, Ethan, do you live on campus?
Until last year I did. Now I'm living at the Edge at Oakland apartment complex. It's about a quarter mile north of campus.
So I wonder, how are you and the other student leaders and even the school leaders trying to address what happens off campus?
It seems to me like off campus has been a bit of a lesser priority. So there are guidelines that apply equally to commuters and residents, but there don't seem to be many guidelines specifically targeted at commuters, whereas there are a lot of policies specifically designed to try to keep the residents safe. Even though it's largely a commuter campus, it seems like the residents are at the greatest risk right now. And so a lot of the policies are focusing on them.
Did you have to get a COVID test in order to return to school?
I did not, but I believe every resident had to get tested before they could move in.
So you're a college student, and we've seen what's happening on campuses across the country as well as here in the state of Michigan, Central Michigan University, University of Michigan, and they've had some of these outbreaks. People are still partying. You're college kids. Are you worried that the same scene is going to unfold there at Oakland University and they're going to shut down the campus and make you guys go completely remote?
I am certainly a bit worried about that. I think we have an advantage because we're largely a commuter campus. We have a relatively small resident population, and so there's less opportunity for those sorts of outbreaks to occur. But it does seem like if even a small percentage of the residents don't follow their rules, then we're going to end up with an outbreak and they will shut down again like we did at the end of the winter.
Ethan Bradley with us. He's the student body president at Oakland University. With us on the Oakland County Megacast. Ethan, you're also part of the Campus Election Engagement Project. Can you explain to our audience what that project is and how it's aimed at increasing engagement in this upcoming election?
Yeah, so the Campus Election Engagement Project is focused on peer election engagement. My advisor for that always likes to joke about how college students don't want to listen to her. She's old. They want to listen to what their peers have to say about voting. So the goal of the Campus Election Engagement Project is to make information about voting available to students in the most effective way we can. That's been particularly different as we prepared over the summer and also as we're starting to get into our fall routine. We can't do a lot of the things we normally do. Usually we'll get a lot of our hours done by tabling for voter registration, but that's a lot harder right now. And there's been a bigger push for absentee ballot focused engagement because we know that students aren't going to feel safe going to the polls.
So what are some of the things that you're doing in order to try to make that happen and to get that information to some of the students, especially like you said, you're such a commuter college?
Yeah, so the director of civic affairs for Student Congress has been helping me a lot with this. He's also the Campus Vote Project fellow, so we work together a lot on these things. He has set up a voter engagement day where we're going to be tabling to the best of our ability. We'll have extra long tables so we know how to distance, and we'll be using QR codes instead of the paper forms we typically use. But still trying to reach students directly and put a face on the message we're trying to give them. But we're also planning some more focused engagement that applies specifically to this year. So our Office for Student Involvement always sells stamps at their window, but this semester, one Friday a month, you'll be able to get free stamps from them, and those are provided with a subsidy from Student Congress.
So as a political science major, this must be an interesting time with everything that's going on in our country and in politics. What's your take on what you're seeing? And as a college student who's trying to engage other students into getting involved in the voting process, how do you navigate so much of the information that is out there and to be able to provide accurate information to those students?
So providing accurate information is one of our biggest struggles because Michigan has been changing voting rules a lot recently because of ballot proposals from 2018 and the introduction of online voter registration, and now these changes with the prevalence of absentee voting. Having up-to-date information is really important as we try to keep in contact with clerks and with the Secretary of State's office so that we have accurate information and so that we have sources in case people question our information. You know, we're young and to a certain extent, people will assume that we're wrong if they've heard conflicting information. So we like to be able to say, this is where I heard that. And from my perspective as a political science major, I just think it's incredibly important for students to vote because we so rarely do. We have one of the lowest voting rates of any demographic in the 18 to 24 age range, and that affects us. There are important state level and local level policies like university funding and road funding that are really important to university students, especially to commuter students, but that we don't have as much power as we could have over because we don't vote.
Ethan Bradley with us. He's the student body president at Oakland University with us on the Oakland County Megacast. Ethan, just a few more minutes with you before we have to let you go. Is there anything else that you'd like to talk about today that we haven't discussed, or any other information that you believe would be important for our audience to know?
I think it's important to note that, as I briefly mentioned earlier, most of the students that we've seen on campus have been following our rules, even though the enforcement mechanism is not perhaps as strong as it could be. My vice president is also a resident assistant, and so she's been assisting with move-in, and she's seen very few students not wearing masks, and generally if you just ask them to wear a mask, they'll put one on. And I think it's also important to note that Oakland's community is going to play a very big role in how we manage this enforcement, in how we keep our community safe. Because the OU Police Department and the Dean of Students Office don't want to be trigger happy with punishing people for not following these guidelines. It's important that as a community we convince each other to keep each other safe.
Like you said, students will listen to one another more than they will us old people. Hey, real quick before we let you go, I want to just ask, at the beginning you were talking about the tracking. Is it a tracking app to help you guys with the COVID symptoms and tracking? What is that and how does that work?
Yeah, so it's a little sticker that you put on your chest, and it tracks some vitals, I believe, like heart rate and temperature, tracks your activity levels, and then it connects to an app which can tell you a couple things. Number one, it's able to predict if you're going to get sick based off of your other vitals. So something about how you sleep or how you move or your heart rate can predict if you're going to develop a cough and a fever in a few days. And the other thing is that it is Bluetooth enabled, and these they're called bio buttons. The bio buttons can talk to each other, and the idea is that if you've been near someone who's wearing a bio button and who is sick, it will let you know that you've been exposed.
Wow, that's fascinating to me. Any concerns about your privacy in wearing this?
There was a big backlash when this was initially proposed, largely because it was originally supposed to be mandatory for resident students. And then that was sort of drawn back, and now it's optional for everybody. Personally, I think it's a worthwhile sacrifice of privacy. I already sacrifice my privacy all the time for minor conveniences like social media, and so I am not worried personally about sacrificing my privacy a little bit more to potentially keep me safe and keep my community safe.
So fascinating what some of these college campuses are coming up with. Ethan, thank you for being with us on the Oakland County Megacast.
Thank you.
Good luck this semester, and stay safe and stay healthy. Stay out of trouble. No parties.
Thank you. I will try, and I definitely will not be going to parties.
We recorded that for your mom to see, by the way.
You did.
Ethan Bradley with us
That's
on
good.
the Oakland County Megacast. He's the student body president over at Oakland University, doing creative things to try to keep the students safe as they head back to school, which starts this week. So thank you, Ethan. We're going to take a quick break here on the Oakland County Megacast, and when we come back, we are going to be taking a peek behind the curtains when it comes to entertainment during COVID-19.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19.
Wear a mask.
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 The ball's in your court, Michigan.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
This is the Oakland County Megacast on CivicCenterTV.com, Birmingham Area Municipal Access, and 89.3 Lakes FM, 88.1 FM, The Biff. Huge shout out today to our Facebook partner of the day, Orchard Mall, streaming us live on their Facebook page. We appreciate that. If you live in the area, be sure to stop by, frequent their shops and their businesses as they continue to struggle during COVID-19 in this pandemic. While many of them are reopened, it is not at full capacity, and so they are still struggling as well. We like to support our local businesses. The other person we want to go ahead and support is we like to support our entertainment business as well, because I don't know about you, Tyler, but I logged some serious hours on Xfinity On Demand, Netflix, Amazon Prime, you name it, I pretty much have been watching it.
Yeah. When I'm not in this building entertaining myself with all the wild and crazy antics that we get into over here at Civic Center TV, I do about the same.
So, hey, Dustin Cehaich, he's an actor, writer, and an editor. How many hours of TV and movies have you been watching during this?
Oh, man. That is hard to answer because it's so much. I also really enjoy creators on other platforms. So I've been watching a lot of YouTube stuff and all that, but it's a lot. It's one of the only ways. That and my dogs is the only reason I've gotten through all of quarantine.
You know, what happened back in the beginning? They were coming out with that new platform. It was going to be those short little movies.
It was Quibi. Yeah, it was Quibi.
What happened to that? It seems like it didn't really take off.
It was an awful idea.
Yeah, it did not, I don't know. I saw all the ads and the commercials, and it was kind of interesting, but I think too many other apps already do something similar, and I don't know. I never got into it.
So, Dustin, go ahead and introduce yourself. Tell us what exactly you've been up to these days, and what are some of the projects you're working on?
So, what I've been up to for the most part is not a whole lot, but something I was involved with recently was the 48-hour Detroit Film Festival. I was brought in by Stargazer Digital Media to help them out. I was initially just brought in as an actor, but I ended up being able to help in a bunch of different ways. I helped them write their script. And yeah, so that's the one main thing I've been doing. Other than that, I am a acting major and cinema studies with specialization in filmmaking major. So very focused on the arts. I'm in my final year, and I am the vice president of our Filmmakers Guild on campus. So I'm super involved in a lot of different things. And yeah, that's pretty much. I wish I could have done more over the summer, but with COVID, it was like really hard to organize any sort of filming because you just want to be safe, and it's not exactly like the most easy thing to be safe with. But I was really happy that the crew that I worked with for the 48-hour was incredibly safe. Everybody was masked the entire time. We kept a safe distance, and it was just a really awesome experience. And I was happy about that because I was initially kind of afraid.
So Dustin, it takes a long time to produce a film, to put a film together, and to do one in 48 hours is a challenge in and of itself in normal times. What were some of the additional challenges that was presented to you and to other people on the cast and crew of the project you worked on that was in the 48-hour film festival?
Yeah, so for me as an actor, one of the most difficult things was the trying to remember, not to keep my social distancing, even though some of the scenes called for me to be very close to other actors. But other than that, other than the one other actor I was working with, it was hard to remember to just stay separate from other people, because usually on set you get up close and personal. It's not a typical thing for you to be super far apart. So for me, that was one of the hardest things to do. And, a 48-hour or a 24-hour is always going to bring up insane challenges that you never expected to happen. But honestly, there was not a whole lot of added difficulty from COVID except for the concept of our spaces that we were working in and everything, keeping it safe and sanitized and all that stuff. That was the only difficult thing, but the people I worked with were so good at what they were doing that it really wasn't that difficult. So I will say that I expected there to be a lot more difficulties added on to the typical 48-hour situation, but because of the team I was working with and their ability to handle pretty much anything that happened, there wasn't a whole lot more difficulty than normally at a 48 hours. So that was a good experience.
And for people who aren't familiar with this 48-hour festival, it is really a cool project that they do every year. I'm not sure how long it's been going on, but just give us a little bit of background on the project and how it works. You're basically coming together and putting this together in 48 hours, right?
Yeah, so basically what happens is Friday, it goes from Friday to Sunday. And Friday at 7 o'clock, they have a kickoff. I think they start the kickoff at 6. But they talk about the rules and everything, and they give you some guidelines that you have to follow at the end of that meeting. So they'll give you a character, a prop, a genre, and then a specific line that you have to use in your film. And that's all of the and a prop. So they'll give you those at the end of that meeting, which is usually right around 7 o'clock. And after that happens, you got 48 hours to plan, write the script, create a shot list, get out there and go film it and edit it in that 48 hours. So that's essentially how it works. You can sort of kind of plan in the weeks coming up to it. Like you can have ideas for films on the back burner. But if you have an idea for a film that's, say, like a romantic film, and then you get a genre that's like a Western, you could still incorporate that, but chances are the idea that you had is not necessarily super good for that genre. So you have to adjust and figure something out, because I've had many, I do a lot of really short film competitions because I love them. You learn a whole lot during these. But yeah, I just lost my train of thought.
But it's like a 48-hour adrenaline rush.
Yes.
Trying to get this done and the finished product completed and able to then share it with other participants in the film festival. So, Dustin, you said that you are studying acting. What do you see as the future of the industry, and do you think you're going to stay the line because you think COVID's going to go away, or is this you're just going to have to navigate the future as whatever it brings you?
Yeah, so I think it's, well, I have a special case because I do the acting, but I also do behind the camera and technical work. So I have a little bit, like, I'm not super relying on the acting portion. I love acting, and it's something that any chance I get, I will do. But when it comes down to like actual career, I see myself ending up in the film industry and doing more technical stuff, probably more often because there's a bigger need for that. But I'm obviously still going to try to act. And I think, obviously, theater acting is going to be on hold for a long time. And I don't foresee that changing until, ultimately, until there's a vaccine of some sort and we don't have to be as concerned in our everyday lives. But film work still is something that is continuing right now. It's obviously not happening as much and not to such a grand scale, but I think that artists in general are very good at adjusting to difficult situations all the time, because, people who make movies and people who do theater genuinely don't always have a lot of funding, so they have to figure out a way to do things all the time with less than adequate guidelines. So I'm not super worried about that in general, because I think as artists, we just kind of keep pushing forward and we try to find ways to make content without, with our new guidelines that we have. So I'm not particularly worried, and I'm still going to stay the course, because at the end of the day, this is what I need to do in my life. I need to make movies. I need to act. I need to edit and write. Like there's no other option for me.
Well, Dustin Cehaich with us. He's an actor, writer, editor, a student. And while some of those things that you just mentioned, writing, things of that nature, can be done solo. When it comes to learning new skills, such as filming or a new piece of equipment, a lot of that is done one-on-one close contact. So how are you trying to navigate that and learning these new skills, picking up these new skills, but then keeping 6 feet apart from someone?
So ironically, yes, most instruction, it's easier to do it in close proximity. But at the end of the day, classes can only teach you so much as far as writing and filmmaking and all that stuff. What it comes down to is really how much you do on your own. Because I've learned so much from our instructors on campus. Like I can't even list it all off because there's too much. You know, I've learned so much about lighting and directing and everything. But it's really on you to take the time to go into it. So a good example is Adobe After Effects. It's so important for the editing world. You got to know how to do After Effects programs because that's what people really need. They need people who are proficient at that. And we don't have, we have an After Effects course that can teach us basic stuff, but in order to really become proficient with After Effects, you have to go through and you have to do hours and hours and hours and hours of work outside of classrooms and stuff like that. So I would say that as much as one-on-one instruction not being a thing that's super able to happen right now, you can still do a whole lot to learn other things and practice. And that's ultimately what it is. The more you practice, the more you work on things, the more you're going to know. And yeah, it definitely sucks to not be able to have that in-person instruction because I'm a person that really learns by doing. So it's hard for me to look at like a lecture or written guidelines of what to do and then learn and remember it. But again, just for now, we're not able to do the in-person thing, which is scary and unfortunate. But I think if people just, keep practicing and keep working on their craft, that they're going to be successful.
Dustin Cehaich with us, actor, writer, editor, and student on the Oakland County Megacast. Dustin, just a few more minutes with you before we got to let you go. Is there anything else that you'd like to talk about today or any other interesting information that would be good for our audience to know that you'd like to speak on?
I think that just ultimately, I would love to say, just remember that artists, we do it for ourselves to an extent, but when people are writing and acting and creating movies and creating content, obviously, we want to be self-sufficient, we want to support ourselves, but it's not about just that. It's about telling stories, it's about providing entertainment, it's about keeping people happy and all that good stuff. So just support your local artists. It's just really important right now. It's super important right now. People have gone on different platforms to try and continue doing stuff. I know that one person, I found her on TikTok and I've been following her, and she's a very talented musical theater actress, singer. She's so talented. So she's been using the TikTok platform to try and do stuff while quarantine's going on because she can't perform, she can't sing in person, and it's just go follow, go like people's videos, go support the artists because they're having a tough time right now.
So Dustin, mentioning that, where can people find you and some of your work, and what's next? Do you have any projects in the pipeline?
So I'm not entirely sure how everything's going to work, but one thing I always do is the Oakland 24-hour film festival that we have on campus during homecoming weekend. I'm not sure what that's going to look like this year. I'm also in my final year of stuff, so I've got multiple film classes that I'm working on. So I'll be working on one film class this semester, and then I have 2 next semester, including my thesis film. So I'll be working on both of those. Me personally, I do a couple of things. I have a YouTube channel. It's just my name. And then I also stream on Twitch because that's one thing I picked up over the summer. That's a fun thing. I also edit and put videos on YouTube for my gaming stuff, but I foresee that taking a back seat to my schooling for the next 6 months. But yeah, that's where I'm at. I also have a TikTok, but I don't really use it as much as other people do.
social media,
Oh,
helping to get your work out there to the public. Dustin Cehaich, thank you so much. And you know what? Good luck this year. Good luck with your studies and your future as well. And I'm going to look for you on TikTok.
Thank you. If you want to look for me on TikTok, it's Castle3451. Most of my other platforms are Castle345, but somebody already took it on TikTok, so I had to add a 1 there.
Fever.
But yeah, I really appreciate you having me on the show. It's been a fun experience.
Well, good. Thank you, and keep making films. And the Detroit 48 Film Festival, I believe they have their screenings coming up this week. It is a crazy 48 hours for all of those that do participate in it. And I'll tell you, some of these participants, people like Dustin, so incredibly talented, and to be able to do it like that, it's like 48 hours of no sleep and just some craziness. So just about 30 seconds left here on the Oakland County Megacast. Tyler, thank you so much as always for your help and getting the program on as well. Tyler does so much behind the scenes that people, I don't think they understand, not just for the Oakland County Megacast, but for Civic Center TV as well. So for the entire team here, Jake, Larry, Ryan, Tyler, and myself, we say thank you. Have a good day. Stay safe.